There are new details from a first-in-the-nation study of people who drank contaminated water at the former Pease Air Force Base in Portsmouth, New Hampshire.
Nearly 1,000 adults and kids were found to have much higher concentrations of PFAS chemicals than the general population. A forthcoming report may link some health conditions to the compounds, answers that could better inform other exposed communities across the country. News 9's Vivian Lee reports.
Are there ways to lower PFAS in your blood?
To say that Andrea Amico has been waiting a long time for answers is an understatement.
My children are getting older now and just wanting to know if this will impact them as they continue to grow.
It's been nearly 10 years since she discovered that her husband and two older children drank water contaminated with PFAS chemicals at the Pease trade port, at work and at daycare. The former Air Force Base is home to more than 200 companies and about 10,000 employees.
Get a heavy fire on the rear of the aircraft.
The compounds were in firefighting foam used in training exercises. She and other moms fought for a groundbreaking study that began in 2019, conducted by the Agency for Toxic Substances and Disease Registry.
Here today for the Pease study.
News Center Maine was on hand when Amico's then 9-year-old daughter underwent blood testing and other health screenings for the study, which drew nearly 1,000 adults and children. The first report released last month found that the group had high amounts of a variety of PFAS chemicals in their bodies, but the concentrations were lower compared to blood tests taken between 2015 and 2017.
They started from a higher level than most people in the country, so that's not good, but it is coming down, and that does feel very encouraging to me.
It underscores the concern people have these chemicals stay in your body for a really long time, and what types of health effects may they cause.
The PFAS levels.
Dr. Aaron Bernstein, who is the director of the National Center for Environmental Health and the ATSDR, met with the Pease community earlier this week. He says a second yet-to-be-released report could reveal possible links between health conditions reported by participants and exposure to the chemicals. The most common included high cholesterol, high blood pressure, heart disease, and diabetes.
But our next step is really to see if you had higher levels of PFAS, were you more likely to have one of these conditions.
Federal health officials didn't say when that second report will be released. The results, though, will be part of a nationwide study looking at the impact of PFAS in 7 other communities.
How does our health effects compare with everybody else, and what type of meaningful information can we get out of a much larger study?
Findings that could be key in guiding areas grappling with PFAS contamination across the country. In Portsmouth, New Hampshire, Vivian Lee, News Center, Maine.
The Centers for Disease Control and Prevention has also released updated guidance that encourages doctors to have discussions with patients about potential exposure to PFAS and to determine if blood testing would be useful.